Good morning, everybody. Good morning and welcome to this IDF Europe symposium on the occasion of World Diabetes Day. My name is Bastian Haug. I'm a director with IDF Europe, and I have the honor to host this meeting or moderate this meeting for the day. I'll just give you a very quick run through of the agenda for the next hour or so. We will start with a few opening remarks by MEP Sirpa Pietikäinen. Then have Niti Paul, our chair at the IDF Europe, give a couple of welcoming remarks for World Diabetes Day and for this symposium. Then hand over to Dr. Gottlob Fabisch from Berlin, from Germany. She will present a case study on diabetes nurses in Germany. And then we will have, of course, time to have a short discussion and Q&A. I would like to encourage everyone to put questions, even while we hear these presentations, opening remarks and words of welcome into the chat, so I can then take them to the speakers. In the second part, we will talk about two COVID-19 surveys that have been carried out by FEND and by IDF Europe. The session will be chaired by Anne-Marie Felton, who is the president of the FEND, the Federation of European Nurses and Diabetes, and by Professor Nebo Seladic, who is our chair-elect at IDF Europe. And the presentations will be done by Dr. Rita Ford from King's College and Sabine Dupont from our office at IDF Europe. And then again, we will have time to discuss these and have a discussion before we close with closing and concluding remarks by MEP Crystal Schaltemose and again, Niti Paul. That's it for the opening. I hope you have all settled in and look forward to an amazing discussion on the role of diabetes nurses in diabetes care in Europe. And with that, I would like to hand over to MEP Sirpa Pietikäinen for her opening remarks. Sirpa, welcome and thank you for joining us.
Thank you, and a happy and bright Diabetes Day to everybody, I dare to say. Because if you look on the history, about 50 years ago, we have proceeded so tremendously on research, understanding and treatment of a diabetes. And it's not anymore that kind of a gloomy panacea that it used to be on our parents and grandparents' times that killed people. So we understand it is not only type 1 or type 2, it is actually more than 40 different kind of types of diabetes. And we understand the genetics, we understand better the treatment, we understand better the role of different kind of diets, exercise, and all possibilities to prevent and to treat and to control diabetes. And this is the basis where the Europe needs to lead. It needs to lead on setting diabetes as one of its priorities on its health programs, because it's a big it is a big disease that impacts a big part of patients and people all over the Europe. And when we are talking about this kind of a non-communicable diseases, there's a lot what we can do in the future. So more money on the research, so we can understand the different genomes, the different root causes. Better and earlier diagnostics starting from the early childhood and on the born. Better food for the people, because there's the linkage on what kind of a food and exercise you have. And it's not always on our own choices what we are offered and how much possibilities to walk and exercise we have during the workday, for example. So take the good lifestyle as a basis for everyday life. Take that kind of information, food information, as a basis that helps people to have healthier diets and support it with VAT and other actions. Erase the hidden sugars in quite a number of the foods that are sold to us. And develop and treat with different medications the conditions even better and better. But to master all this, the role of the nurses is totally crucial and invaluable. And this has been seen in those of the countries where we have a very effective diabetes program and the role of the nurses that give the education, the nutritional education, exercise education, the advice how to not only treat but test your blood sugar levels, when to seek next medical consultations and all this, and who advised the patients to different kind of peer groups and advice groups. The nurses are the sources all over the healthcare system. The early detection of symptoms of diabetes and the risks of diabetes in families. And if we can train all nurses all over Europe and all over the world, because this is World Diabetes Day, to be the effective part on prevention, diagnosis, and treatment of a diagnosis, we actually do have a wonderful, bright diabetes every day of the year. With these words, I shut my mouth, I open my ears, and I remain on hearing what you have to say on these very important topics. And me and my colleagues are very committed to work in the future for the betterment of the world and patients with the risk of diabetes or with diabetes. Thank you.
Sirpa, thank you very much for these opening words, and these are especially dear to us because they are coming from you who are co-chairing the newly founded, or I would say the relaunched MEPs Working for Diabetes group that you are starting now, and we will talk about that in just a minute. Thank you for joining us, and I would like to hand over to your colleague, to your co-chair, MEP Christel Schaldemose from Denmark. Christel, are you on the line?
I am, and thank you very much, Bastian, and thank you, Sirpa, for your kind introduction here and framing the whole day. I'm looking very much forward to the discussion we are having. I wanted just to say a couple of words. Why are we MEPs interested in working with diabetes and hosting a day like a seminar like this? That's because we believe that we as MEPs, member of the European Parliament, can make a difference in this area. We can create better awareness. We can put pressure on the European Commission in order to act. And we can put a pressure also in order to find ways to benchmark member states in the EU up against each other, because we know that that has an impact on how they treat patients. But first and foremost, we are doing this in order to make sure that we can deliver for the patients with diabetes. We need to have a patient-focused diabetes plan all over Europe. So I'm looking very much forward to listen today. As Sirpa said, the nurses are key in order to find good care for the patients. And we should be very grateful for their hard work in this area. And I'm looking forward to listen more about what the learnings have been from the different studies. But I just want to say clearly and with no hesitation that we members of the European Parliament, we can play a role, and we want to play a role in the work with diabetes. And therefore we today more or less relaunch our working group for diabetes, members mobilizing for diabetes, as we call it now, in order to tackle other chronic diseases such as diabetes. So thank you for joining, and I will also now close my camera and my microphone and listen and get back to you when we are closing this seminar. Thank you very much.
And Christel, also to you, thank you very much for not only joining us here, but for you and for Sirpa, both of you co-chairing this new interest group or this relaunched interest group. I think this is really, really important. And as you were saying, your conviction that you as MEPs really will make a difference in this, also with regards to the role of the nurse. This is great to hear. With that, I would like to hand over to Dr. Niti Paul, our chair at IDF Europe, for her introductory words to this symposium, to World Diabetes Day, and of course for this interest group as well, which IDF Europe has the honor of organizing. Niti.
Thank you, Bastian. That's good morning. It's really lovely to see you all today. I'm afraid I can't see the participants, but I welcome you to this very virtual World Diabetes Day. Thank you very much for joining us. It's because of you we are here today. What a year it's been. It's a difficult one. Lots of you are shielding, lots of you are having to deliver care in very difficult circumstances, and we're through a second or a third wave of COVID again. But I'd like to celebrate World Diabetes Day with a positive optimism. And I'd like to tell you a little bit about ourselves, about IDF Europe and what we're doing. I'd like to tell you a little bit about my own personal journey. This year for me is the 27th year of diagnosis of my son with type 1 diabetes. So we've lived as a family, as a parent, with a son with type 1 diabetes. And what a lovely and compassionate and brave young man he's turned out to be, just like lovely Bastian on this call. And I've met such amazing people. My life has been enriched by the patients with diabetes, and I continue to advocate for patient-centered care. And that's what you just spoke about, Crystal. Thank you very much for mentioning that. We, of course, are also heading into the centenary of insulin, which is next year. But it's also the 200th anniversary of Florence Nightingale, the lady that changed nursing forever in this world. And what an amazing story it is, so relevant today as well. Wash your hands, infection control, so important for COVID today. So we are celebrating this year on World Diabetes Day, the year of the nurse. And I'm so honored today to have my dear friend and colleague, Anne Felton, on this call. Anne, you've been a role model for nurses across the world in diabetes care. You've tirelessly advocated for the role of the nurse. For us, the nurses that helped us to get to where we are today, I still remember them. I salute them. It was Emma and Adele. I'll never forget your names. You normalized an experience for us that was really, really difficult. Our son was 3 years old when he got diabetes. And the role of the nurse remains equally important in multidisciplinary care. It's social, it's professional, it's everything put together that allows for a patient or their family with diabetes to get care that perhaps they may not be asking their doctor about. And every person in that multidisciplinary field needs to have multidisciplinary care, because everybody brings some different perspective to your care. So I'm very happy this year to be holding the seminar in the year of the nurse, celebrating diabetes nurses and what they brought. And I know that in many countries, you still do not have diabetes nurses in the same kind of way that we have in some of the countries that I've been in and lived and worked in. That is the UK, we have diabetes specialist nurses. You don't often have the luxury of that in many, many countries. And many nurses struggle to get their training, their development, and to really develop the skills they need to do to deliver this care. So we call for action to do that, and we'll talk about that right at the end. And then finally, I'd like to say thank you very much, Crystal and Sirpa, for agreeing to co-chair this newly rejuvenated MEP forum for diabetes. And I'd like to say a few words on the behalf of the European Diabetes Forum, my dear friend Chantal Matthew. So Chantal, would you like to say a few words, please?
Yes, thank you, Niti, and again, welcome to everybody to this fantastic IDF Europe symposium webinar on the nurse. I am, Niti, the proud mother and mother-in-law of a nurse. So I have nurses in my family, and I worked myself as a nurse during my student years, so they're my heroes, together with the patients I treat, the people living with diabetes. Indeed, I just want to introduce briefly the this year founded European Diabetes Forum, which is a broad forum that together with FEND, together with ESD, JDRF, EFSD, IDF Europe, the Primary Care Diabetes Europe, SFD, all coming together with one mission, and that is to give policy advice to our leaders in Europe and in the European Union, but also in other European countries, on how our healthcare systems can cope with the growing epidemic that is diabetes. And so we're extremely happy that in this forum, where we want to bring together all stakeholders, and not in the least the person living with diabetes, to really make a harmony of voices advising our policymakers on how to tackle this epidemic. And so together with IDF Europe, we will also be participating in the interest group of the members of parliament. And so, Niti, we are extremely looking forward to collaborating on this exciting project. And go nurses today.
Thank you very much, Chantal. Thank you for those lovely, kind words. For us, the Year of the Nurse, as we said, remains very, very important to celebrate and to advocate to advocate for that. We have a proper, full strategic advocacy paper that IDF Europe have brought out. We have a survey, we're going to talk about that in a minute, with all our member associations. And for us, our member associations remain the backbone of what we do across Europe. I thank you all for being there, member associations, for all your love and support, and for carrying out all this work that we need to do to raise the profile of diabetes across Europe. Thank you very much. And over to you, Bastian, back to the seminar again. Thank you very much.
Niti, and of course also Chantal, thank you very much for these introductory words, and also for presenting the European Diabetes Forum, which we are very proud to be a part of and joining with all the others. And to make this more concrete now, we come to our next presentation, which is going to be a case study from Germany, presented by Dr. Gottlobe Fabisch, my dear colleague from Berlin. She's the director of the Verband der Diabetes-Beratungs- und Schulungsberufe in Deutschland. That's a very long title. So she represents, it's the German chapter of FEN, basically, in Germany, and she will be presenting on the role of diabetes nurses in Germany. Gottlobe, thank you very much for joining us, and I really look forward to your presentation.
Thank you, Bastian. Good morning from Berlin. Dear members of the European Parliament, dear colleagues, dear ladies and gentlemen, it's really an honor to address you on the occasion of World Diabetes Day 2020. Within the next couple of minutes, I have the pleasure of giving a very brief introduction into the situation of German diabetes educators. To set the scene, if I can manage to, it doesn't work, I'm sorry. I cannot, yeah, no. To set the scene, I will give some preliminary remarks how diabetes care is organized in Germany, then dive into the role of diabetes educators. And in the context, in this context, I have to speak pro domo because my organization plays a key role in the certification of this occupation. And I will conclude with some proposals for improvement in Germany. In 2020, almost 8 million German citizens had been diagnosed with diabetes. And due to several factors like obesity or an aging population, experts predict that we will face almost 12 million by 2040. There are regional differences. We have a higher prevalence, or the highest prevalence, in the east of Germany and in the very west of Germany, next to the French border. Despite these high figures, without any doubt, diabetes care in Germany is of good quality, implemented by an interdisciplinary team and well organized. We distinguish actually 3 levels. The majority of patients, up to 90%, are treated by general practitioners, and we have 60,000 of them. And then we have hospitals who take care of complications and emergencies, and something which are specialized medical diabetes practices. And these practices actually have to have a diabetes educator on board. So diabetes education is actually an integral part of diabetes therapy in Germany, and based on something which is called structured educational programs. These have been scientifically evaluated and certified. This principle is laid down in something called Disease Management Program for Diabetes, in short DMP diabetes. And we have several disease management programs that are actually since 2002 a cornerstone for the treatment of patients with chronic diseases. The DMP for diabetes is diabetes type 2 is the biggest one with more than 4 million patients participating. And the DMP for type 1, diabetes type 1, involves approximately 225,000. So patients enrolled in DMP for diabetes is entitled, but also obliged to structured education. To give you a concrete example, if a patient is newly diagnosed with diabetes, he or she will receive an educational intervention. This intervention is led and implemented by a diabetes educator. The intervention typically takes the form of group sessions and several meetings. The content is actually laid down by the structured education program. And during the intervention, the patient will learn about the disease, how to handle devices, implications for their diet, physical activity. In Germany, we have about 20 of these certified and evaluated education programs addressing different dimensions of diabetes. Diabetes educators then monitor on progress therapy and intervene if problems occur. So they play a very important role in diabetes therapy. With respect to their own education, they are healthcare professionals with varied backgrounds. So 1/3 have a background in nursing, 1/3 are actually dietitians. We also have medical technical assistants, and the minority has an education, an academic education, for instance, a Bachelor of Science or a Master of Science in Nutritional Science or Healthcare Science. This is an important difference compared to other European countries where you have to be a nurse. And it also creates for us as the professional association sometimes problems when representing the interests of diabetes educators. These professionals, healthcare professionals, become diabetes educators by going through a 14-month vocational training program that has been developed and provided by the German Scientific Diabetes Association. So it's not state regulated. Again, a difference to many other countries. Another specific feature of the German situation is that, like doctors, diabetes educators have an obligation to continuously maintain and enhance their skills, and they have to collect credit points and attend and participate in seminars and tutorials. And in this respect, my organization has an important role to play. Therefore, I take the liberty to add a few remarks. The VDBD is the professional association of diabetes educators in Germany with around 4,000 members, and we have been established some 25 years ago. In order to represent the interests of our members, we elaborate position papers, we address political decision makers, we join forces with partner organizations like the German counterpart of IDF at national level and at European level with FENT and IDF. To give you an example, we had a joint campaign with the German Diabetes Association and Diabetes DE calling for a national diabetes strategy. Believe it or not, we are still not having one, but that's another cup of tea. My organization also elaborates practical guidelines for healthcare professionals, and something I would like to stress, we elaborated the first structured education program for relatives of diabetes patients, because as all of you know, patients are affected, but of course their social environment as well. As to the lifelong learning obligation, we established an academy that offers seminars and certification. And without going into too much detail, I just want to stress the fact that we monitor the lifelong learning obligation of diabetes educators and check their credit points and issue the respective certificate every 3 years. And with this, I would like to conclude and tell you that despite the situation is certainly of good quality, diabetes care is of good quality in Germany. We have a well-qualified interdisciplinary team, including diabetes educators. Nonetheless, we see there is room for maneuver and for improvement. Some of our requests are certainly specific to the German situation, so I spare you most of them, but I would like to mention one of the most important one for us, and that is that we ask for accreditation of the profession diabetes educator by the federal state. May I add that in Germany, the 16 Länder are responsible for education and vocational training, and decision-making is as difficult as among EU member states, so we asked for a solution at the federal level. When it comes to salaries and recognition of the role of in the healthcare system, we actually share the same concerns as our European colleagues. There is a definite need for reform and improvement. And in our point of view, this is a must if we want to attract the younger generation to join the profession. Thank you very much.
Good, Lobe. Thank you very much for this presentation, this case study on the role of nurses in Germany. And I would like to welcome all the others to join me now. We have 10-15 minutes for questions and answers. And I would like to encourage, first of all participants to put their questions into the chat or the Q&A session so we can see them and discuss them. But I would also like to invite Niti, Chantal, Sirpa, and Crystal to rejoin now for maybe discussing questions that might be addressed to all of you. But there is indeed two questions that have come in just now for you, Gottlob Fabisch. I start with the more precise one. One is a very easy yes or no question, but it's the one we hear quite a lot because we have people from all different European regions joining. Regarding the role of the nurse in Germany, do nurses in Germany have the role to prescribe? This is one of the questions we hear a lot.
Well, as I've explained, diabetes educators have a varied background, so only some of them are nurses, but even nurses do not have the right to prescribe. We don't have prescriptive nurses in Germany. And that is actually a very, very complicated story.
I know, but is this something you would call for a change in that kind of policy, in that right to prescribe?
Well, I can only speak for diabetes educators, but in order to go into something which we call in Germany substitution, you also have to have the skills. So this would really, a precondition for that would be an academic education. And as I described, currently diabetes educators in general do not have an academic education.
Perhaps I can pick that up, Bastian. Certainly in the UK, it was a battle to get nurses to prescribe. And I can remember training my first advanced nurse practitioner on prescribing. This was in general practice. I'm a family doctor. And it was a battle to get that. But I can't tell you how much that is valued. And today we have a workforce that is skilled, and this is for certain things. You don't have to be able to prescribe everything. My diabetes nurses in my own practice, these are primary care nurses, by the way. We're not even talking about somebody in a hospital as a diabetes specialist nurse. Independently ran their own diabetes clinics and their own caseload, and were able to alter medication without having constantly to go to the doctor. Now, this is things like metformin and simple drugs that can be easily titrated according to a guideline set. Now, even that would make such a big difference to people with diabetes, not having the bottleneck of constantly having to go to a hospital doctor or to another doctor to get some of this done. So for me, this is a basic thing that we should be calling for. And diabetes specialist nurses have such a skill, particularly around insulin management and actually instituting insulin. So in the UK, diabetes specialist nurses can start insulin. So again, that's a very big thing that we should be advocating for, so that you can stop having to wait months sometimes with your diabetes control worsening.
And I see Anne-Marie Felton would like to quickly comment on this. Anne-Marie Felton, it's great to have you on this call. Go ahead. I'm sure you have something to say about this as well.
Of course, I'm never short of a word or two. I think it's really important to understand that if one is an educator, particularly in relation to diabetes or any other condition, that there is an implication that you need to be competent in law to be able to prescribe and intervene. And in the context of Europe, let me just enumerate the countries where this has happened over the last 20 years. Nitti will remember the Crown Report, and it took nearly 15 years to get that through primary legislation in the United Kingdom, and I was part of that group, as was Nitti. But so the Northern European countries are very well established in relation to the prescribing, and it isn't just diabetes drugs, that is called, because we know we have to control blood pressure and other things. I won't go into the detail. The other areas to take in countries is Spain, but perhaps this is more to do with the provinces. And the Catalonian region is way ahead of any other province in Spain in relation to prescribing, and also in Athens. So this is law. And I really do appreciate my colleague, Dr. Peverish, in her comments. Nursing is I understand the nature of vocation, but it is a profession, and it is accountable in law for each one of us for our own actions. I won't go on any further, but it is well established. And interestingly, of course, it is the people with diabetes who will refer if they have some difficulty that they haven't experienced before in relation to their diabetes management for a particular incident or whatever. So thank you very much for the opportunity to intervene at that level.
Of course, you're very welcome, Anne-Marie Felton. There is another question here. I think that is also towards Dr. Gottlob-Fabisch, but could be answered on a general level as well. The question is, I've been searching for a specific diabetes self-management program designed for the elderly, for elder people. It seems there's currently no program for this target population. And this question is from Veronica Izquierdo. Gottlob, do we have a program specifically for training for nurses for the elderly in Germany?
We do have, and I'm happy to give all the information to the person if she sends me or you an email or a text message with her coordinates.
Wonderful. I think we will definitely make that work. Veronica Izquierdo, we will get in touch with you and establish that connection. Great.
I would like to add a remark. In Germany, we still have a very doctor-centered system. And in order to reach what you have obtained in the UK, we need a coalition partner. And if we don't have the doctors as coalition partners, we will not convince politicians. So it's really, really a very tough situation in this respect.
And talking about the political side of things, because I want to make sure that we also give Sirpa and Crystal maybe a chance to talk. There is a comment here by Adrian Sanders, who is the Secretary General of Parliamentarians for the Diabetes Global Network. And he is mentioning the goal 3 of the WHO Sustainable Development Goals, ensuring healthy lives and promoting the well-being for all at all ages, and that this should be met by the end of this year, which is just a few weeks away now. So his question is, what action can the EU take to ensure that member states meet these goals, in particular in relation to diabetes? Crystal or Sirpa, would you like to take that up?
Well, let me start then. Well, a good question, and I can't answer directly. The thing is, the way things are working in Europe is that health questions, and we all realized that during the COVID-19 crisis, is for the competence of the of the member state, and therefore to do something in this area is directly up to the individual member state. But of course, we have all signed up for the new development goals, and therefore every member state needs to do something in this area. but EU cannot do. But what I think we can do at the European level is to benchmark, to show what is happening in each member state, because everybody knows that being the good example is good for a member state. Being the bad example is really worse. And member states tend to not like to be the doing bad when you are compared to other member states. So therefore, I do believe that benchmarking is a part of the tool in order to achieve more here. But of course, also exchange best practices and even calling for national diabetes plans is important, and we still have member states not having anyone or have not adjusted them recently. So I think we can do something, but more on another level than direct involvement in how the member states tackle this. I hope that it was enough, Bastian.
Thank you very much, Crystal. There is another question coming in from Maria Stella de Sabata from the board of IDF Europe, in fact, and from Italy. She's asking again to Dr. Gottlob Fabisch, where's the bottleneck in the accreditation issue in Germany? And then also more general, are there any lessons learned from other countries? So maybe Gottlob, you could start, and then maybe Anne-Marie Felton, you can come in with other best practices.
Yeah, the bottleneck is actually that we are a federal state and that the competence for this question sits with the German 16 Länder, and it's very, very difficult to get to a common decision, and it's really as difficult as at the European level. So that's the main bottleneck I would like to point out at this stage.
Anne, would you like to comment?
Yeah. I do understand the unique position of Germany in relation to the recognition of nursing as a profession, and that's the stumbling block. I don't know what Nightingale would say about that, but I don't think she would be best pleased. However, what is really interesting, and as I've observed it over the years, younger, diabetologists, endocrinologists in Germany are much more orientated and integrated in the context of interdisciplinary teams. And one of your former and late great Professor Michael Berger was so inspirational in that. And I think that time is of the essence, and elevating the vocation of nursing in Germany to the professional status will actually change that. But that really requires extraordinary teamwork across all of the disciplines. I think it's too narrow defining it as educator, because it's more than that. There are clinicians, there are researchers and so on. I don't want to go on about it, but really I think IDF Europe, and this is where Nitty, Paul and Bastian and our MEPs who are here, who have through their life, and particularly Crystal, who has really championed all of this in the European Parliament. This is the time for change. And as I note, there is interesting discussion within the European institution with regard to the competence of the EU institutions, e.g. DG Sanko, GD Research, in relation to issuing directives. Now there's a change. I know the UK isn't part of it, but the UK is only one country in the whole of Europe, and we're talking about the whole of Europe. I would suggest to you that we need to get together, and I don't know whether Chantal is here, but again, the EU, the forum is actually a broad church, and we need to address this, but we also need to address it in the context of dietitians as well. So we have a real opportunity in 2021 as we celebrate the discovery of insulin and this life-saving intervention. So Christelle, over to you.
Crystal, would you like to comment directly?
Yes, but I do believe that we need to discuss this and see what we can do and compare how it works and what is needed and what are the barriers, at least at European level, to do something in this area. Whether or not we should make an EU law on this, I doubt it, but we should be better in, we already have discussing a lot of mutual recognition of professional qualifications. Maybe we could do more in this area, but as you might remember, a couple of years ago, we had a very big debate around nurses circulating when we had to make a revision on the professional the recognition on professional competences, and especially around Germany, because Germany has another system than the majority of, or at least than many member states. Anyway, Anne-Marie, I think you're right. Let's see what we can do. At least continue this kind of discussion. Because we also see a cross-border aspect when people are traveling, both for works and for private purposes. I know that we are not traveling now, but I hope that there will be a time after COVID where we start traveling again, and people working and living in each other countries. I think we need to do more in this area. How we do it, that's another question, but I will promise you that I will make sure that we will take a discussion on this at the European level in the European Parliament in 2021.
Thank you, Crystal. Could I just quickly say something? We've just, in my other professional life, we've just published a book. I believe that the 21st century will be about the human workforce in healthcare. We're going to be more than 6 million doctors and nurses short worldwide in the next 30 years. There's going to be huge competition for professional skills and doctors and nurses and others in healthcare. So I think this is a very, very big opportunity that Europe needs to address. How do we get skills mixed? How do we need to get skills up? Otherwise, we're heading for a total disaster in healthcare because the human element of it will vanish. There'll be such a fight for skills, healthcare skills across the world.
I actually have a question that just came in on exactly that point towards Gottlob Fabisch, whether there were recommendations to policymakers to address the shortage of diabetes nurses and educators in Germany. Gottlob, anything you are specifically aware of?
Actually, at the moment, we do not have a shortage of diabetes educators in the entire Germany. It's question of where you are located. So there are regions where it's indeed very difficult to find a diabetes educator. But we actually have around 200, more than 200 people each year going through this vocational training program. So in our point of view, figures are quite okay. But when it comes to the nursing profession, because we of course have nurses, there we have a huge shortage, and the German government is taking a number of steps in order to change that. I don't know whether we are now going into these kind of details, but it's certainly linked to salaries, to the conditions under which you have to work. And this will hit us hard, as Niti Paul just outlined, because I don't know why, but some of our professions in the healthcare system are just closing their eyes and not tackling this very important question, and it will hit us very hard, and it already does a bit, as we have seen that nurses coming from abroad, they are used to a completely different way of working. They are leaving again because they do not understand the German system. But I don't want to occupy the entire discussion because we have a very specific system which is very doctor-centered and a very a bit outdated, I'd say.
Gottlob, thank you very much. Thank you very much for bringing this German case study to the table here, because I think there is also some strengths in that system and lessons learned for others maybe. And I think this was a great discussion across the board. Thank you very much, Gottlob. Thank you very much to Sirpa and to Crystal for joining this opening, and of course to Niti and Chantal, and for Anne-Marie Felton for jumping in. We had a last question on how COVID-19 has affected the role of the nurses, but I would like to skip that for now and move on to the next session, because that is around COVID-19. I would now like to ask all presenters, but for Anne-Marie Felton, who will be chairing the next session, and Rita Ford, who will be presenting, to please turn off your cameras. So everybody on the call, thank you very much for now. Please turn off your cameras, and we will now get to the second session of this IDF Europe World Diabetes Day Symposium. We will be presenting two surveys that have been carried out on COVID-19, one by FEND, which will be chaired and introduced by Anne-Marie Felton and Dr. Rita Ford. The second one has been carried out by ourselves, by IDF Europe, and it will be presented by Professor Nebosa, who will chair the session with Anne-Marie Felton and Sabine Dupont from our office. Anne-Marie Felton, please go ahead and then hand over to Rita. Thank you.
Thank you very much, Bastian, and for your excellent moderation thus far. It's my very great pleasure to introduce all of you to Dr. Rita Ford, who is the FEND postdoc fellow in diabetes at King's College in London. Well, actually, the Florence Nightingale Faculty of Nursing and Midwifery and Palliative Care in London, though I think she's currently in Ireland, in the Republic of Ireland. So her presentation she will share with you her presentation, the findings of the summary of that FEND commissioned in relation to the effect of COVID on people with diabetes, but particularly the service provision from the nurse specialist perspective, both in primary and secondary care. And I would wish at another point to make some observations with regard to the academic accredited programs that FEND provide. Dr. Rita Ford, very warm welcome, and I look forward to hearing again the summary of your research.
Good morning, everybody, and it is a pleasure to share with you this morning some of the data from the Foundation of European Nurses in Diabetes COVID-19 survey, and particularly on this, the IDF Europe's Symposium for World Diabetes Day, with the theme of Diabetes Nurses Do Make a Difference. So this survey was conducted by a consortium established by a collaboration between the Foundation of European Nurses in Diabetes and the clinical research and in diabetes team at the Florence Nightingale Faculty of Nursing, Midwifery and Palliative Care at King's College London, whilst also drawing on FEND's extensive pan-European network of diabetes nurses and also nurses who have formally undertaken the FEND NCUP higher education programs, which FEND established and fund across Europe. And in the true spirit of working together whilst being apart, we were able to work with diabetes nurses from across Europe to both develop and disseminate the survey. Professor Angus Forbes and I led the survey, and it was a real pleasure for both of us to work with so many dedicated diabetes nurses who were both clinically and academically focused on diabetes care. And in this, the International Year of the Nurse and Midwife, as well as being the 25th anniversary since the foundation of FEND, it was inspiring to experience the enthusiasm and general goodwill of so many people, and we are grateful for everybody's support. Now, we'll agree the diabetes nursing workforce make a major contribution to the care of people living with diabetes. And as such, this workforce have a significant oversight of how the COVID-19 pandemic has impacted on diabetes care and delivery. Therefore, the aims of this consortium were to work with nurses to characterise their perspectives of the impact of diabetes, the impact of the pandemic on diabetes services, the impact on people living with diabetes, and also the impact of the pandemic on diabetes nurses themselves. And so from conversations that initiated in London, we were able to gather momentum, and this consortium now has representation from nurses from 22 countries across Europe. The survey was developed in English and translated into 16 additional languages by the country leads of the consortium, and thus we preserved the fidelity of the questions during this translation process. And while the survey was initially disseminated via the 22 member countries of the consortium, it has been cascaded to an additional 5 countries across using diabetes nursing networks. The survey was disseminated via electronically during June and July of 2020. In total, 2,212 nurses responded to this survey. However, we were only able to include 1,666 responses, as anybody who had completed less than 60% of a survey was excluded. So in relation to the distribution of the responses per country, we can see that 1/3 of the responses did come from the UK. And while there are a number of countries with less than 20 responses, where there were a number of countries with less than 20 responses, we have categorized these as other. And these countries include or represent the countries with smaller numbers of diabetes nurses, such as Gibraltar and Malta. And in relation to the analysis of the data from this survey, the intention was to provide a descriptive characterization of the diabetes nurse's perspective. Therefore, we have not weighted the responses per country. Importantly, almost 2/3 of the nurses who responded to this survey have worked in diabetes care for 8 years or more. Over 1/4 of the respondents were educated to at least a degree level, and those with a degree level education, almost 50% of those have additional postgraduate level qualifications specifically in diabetes. So for our survey, we have reached a cohort of highly experienced and highly educated diabetes nurses from across Europe to share their perspectives with us. The nurses reported an increased risk to both the physical and psychological health for people living with diabetes during the pandemic. And whilst this is a busy chart, you can see that there is some variation between countries in their assessment between the psychological and physical health risks. However, most countries have indicated that the greatest risk to people living with diabetes during the pandemic has been to their psychological health. And there are some countries who have indicated an equivalent physical and psychological risk. And we can see from this graph, countries such as Croatia, Italy, Poland, Romania, Spain, and Turkey have done so.
Rita, can I very quickly come in? There seems to be a slight irritation with the slide presentation, which I think has now been taken over by the office. It's not completely in sync. So it seems that you are not sharing your slide, but...
Oh, apologies. Will I stop sharing then, or
we do see it now. We are now at the slide where it says the proportion of nurses indicating increased risk to physical and psychological health. So if that is okay, or which slide are you on right now in your presentation?
Okay, I will try and take over sharing the screen again, if that's okay. Apologies for this. Now, can people see?
That is working. Yes, thank you very much.
Okay, now I just need to. Sorry, now I just need to try and get back the control of the presentation, which seems to have. Ah, yes, here we are. Apologies for that. So I will just go back to this slide. So this slide just shows the proportion of nurses who indicated both the psychological and physical risks to people living with diabetes during the pandemic. In relation to the physical impact of the pandemic on people living with diabetes, nurses reported a significant increase in relation to hypo and hyperglycemia, while almost a fifth of the nurses reported an significant increase in the risk of presentation of foot complications. Now, in relation to this, we do know from subsequently from data from Italy that this has had a significant legacy in relation to significant amputation and severe foot complications subsequent to the initial phases of the pandemic. Importantly, the nurses also reported that almost half of the nurses reported a significant increase in depression amongst people living with diabetes. 2/3 of the respondents indicated a significant increase in diabetes distress amongst people living with diabetes, while over 80% of the nurses indicated a significant increase in the level of anxiety amongst people living with diabetes attending their services. And in relation to the impact of diabetes services and resources, the nurses reported on the disruption to services. And as we can see, the majority of nurses indicated that there was some level of disruption during the pandemic, with almost half of the respondents indicating this was quite severe or extreme. The disruption to the self-management support that nurses could provide to people living with diabetes during the pandemic was also reported to have been significantly disrupted. And for 1/3 of the respondents, this was reported as severe or an extreme disruption. the provision of diabetes education, almost 2/3 of the respondents indicated that for people living with diabetes, this was disrupted either severely or extremely during the pandemic. And for the technical support that nurses were able to provide to people living with diabetes during the pandemic, the majority of nurses indicated again that this was disrupted to some degree, with almost a fifth indicating that this was either quite severe or an extreme disruption. And the psychological support, again, we can see almost 1/3 of the nurses indicated that there was a severe or extreme disruption to the services they could provide to people living with diabetes. In relation to the method of contact nurses had with people living with diabetes, they were asked to rank from 1 to 5 the most to least common form of communication they had prior to the pandemic. And as we can see, the majority indicated that the most common form of communication was in relation to face-to-face in-person contact. They were again asked to rank their experiences during the pandemic. And as we can see, there has been a shift towards virtual communication, with most nurses ranking telephone contact and email communication as the most common form of contact during the pandemic. And this shift has been reported as being both opportunistic and challenging by diabetes nurses across Europe, as many nurses were able to avail of governmental support to access equipment and resources to conduct these consultations, while others found it challenging, particularly in the need to rapidly find new ways that were safe and within their resources to conduct diabetes care and consultations during this time. And so to the personal impact of on diabetes nurses during the COVID-19 pandemic. And we can see that this was considerable. So this is a busy slide and I won't take you through all of it, but just we can see that almost 1/3 of the nurses reported feeling very or extremely burnt out, with one respondent sharing that a sense of fear and uncertainty in all aspects, both in work and home. Over 1/5 of the nurses indicated that working during the pandemic had a negative impact on their family, with another sharing how to balance the risks with the need to work. And 3/4 of the nurses who participated in this survey reported to experiencing feeling distress, and this distress was about the care they were able to provide to people living with diabetes, with one nurse sharing that the fear of the collateral damage for not being able to provide support to people living with diabetes, this was considerable. And so to consider the key learnings from our survey, these data show that there has been an increased risk in both the physical and the psychological issues with people living with diabetes during this pandemic. The data also show changes in how diabetes nurses interact with people, with a shift towards virtual consultations. Therefore, going forward, we need strategies to minimise the impact on services and on people living with diabetes for such a rapid shift in how we as diabetes nurses work. I would like to share with you the names of all of the nurses who contributed on this consortium and worked so hard to make it the success that it has been. And I would like to leave you with some contact details of Professor Angus Forbes and myself, and a generic contact detail for the COVID-19 survey should anybody require further information. Thank you, and I will stop sharing my screen now.
Thank you, Rita. Thank you very much. I would like to quickly hand over now to Professor Nebosa Lalic, the co-chair or chair-elect of IDF Europe, and he will be co-chairing this panel discussion, but first presenting Sabine Dupont. But Nebosa, please take it away first.
Okay. Do you hear me? Everything is working? Yes, I hope. So thank you very much, and good morning from my side. Just 1 second. Just 1 second. I would like to deliver my special greetings to Anne-Marie Felton, who is present here, and my co-chair, for her devotion for many years and help that she provided to the nurses' education and to diabetes care all over the world in many countries, including my own. And now let's go to my task. And my task is to inform you that IDF Europe has launched a survey among people living with diabetes to understand how the first wave of the COVID-19 crisis affected people living with diabetes. And this survey was designed to create a picture of the impact of COVID-19, not only on the people and their own needs, but also on the organization of diabetes care across European region and to develop policy recommendations afterwards. The survey was run from August 10 to October 31st and was available in 22 languages. It was promoted by IDF Europe member associations, IDF Europe social media channels, and many of our partners, and we received usable responses from 33 countries in Europe. The full survey results will be available later this year, but now we would present some highlights, and the highlights will be presented by Sabine Dupont, Senior Consultant, Policy and Projects from IDF Europe. Sabine, please.
Thank you, Nebosa, for the introduction. So our survey, we actually received data from about 50 countries, but we decided to weigh the data. So we kept results from 33 countries, as mentioned by Nebosa. And the survey was structured in a number of different sections, and I'm going to report on elements from 3 of those sections, which are living in COVID time, access to medication and supplies, and access to health and diabetes care. So, living in COVID times. So what we saw is that the restrictions on movement had a significant impact on the ability of people living with diabetes to manage their diabetes outside of the medication side. So about 2/3 of them reported being less active during COVID-19, and 1/3 of the respondents showed that they had gained weight. And that, plus the difficulty in accessing medication and services, meant that from a total proportion of 75% of respondents reporting that they were able to manage their diabetes well prior to the pandemic, that number fell down to 60% of people feeling that they were able to manage effectively or very effectively during COVID-19. And that's also evident in the higher variability in blood sugar levels and the number of hypoglycemic and hyperglycemic events that were reported during the crisis. About 1/3 of respondents showed that their blood sugar levels were more variable than usual during the pandemic, and about 1/4 had a higher number of hypoglycemic events than prior to the pandemic. And I think that's quite consistent with the figures that were shown in the FEND survey. We talked a lot about mental health, and our survey also shows a picture of a very important burden for people living with diabetes. 40% of the respondents reported that they felt very or extremely anxious during the first wave of COVID. And half of them reported that they had more often experiences of low moods than prior. So I think that's quite significant in terms of toll. So looking at access to medication and supplies, what we see is a picture of significant disruption across Europe. Prior to COVID, 70% of respondents said that they had no difficulty whatsoever accessing medicines or supplies. And again, that proportion fell to less than 50% during COVID. And the reasons for this are very varied depending on the countries, but every single country in our survey reported greater difficulty in accessing medicines during COVID. And the difficulty reflect a bit of a mix of the severity of the pandemic as well as the organization of the health systems themselves. So for example, in Italy and Spain, travel restrictions were a big factor in people finding it difficult to access their medicines. In other countries, getting a prescription was actually a big problem because you could only get a prescription face to face and people were not able to access their normal doctors or hospitals. So in our survey, Italy, Germany, Spain, Norway, and Greece were the ones showing the most disruption, and Finland, France, Belgium, Luxembourg, and Slovenia the least disruption, but this was still significant. And obviously, as Nebosa said, we just closed the survey on October 31st. So these figures are very much preliminary, and we will need to dig deeper into the data to really unearth the differences between countries. So looking at access to health and diabetes care, what we see is that people felt that they were given very little advice. 60% of respondents reported that they had been given no advice by their diabetes team. And by diabetes team, we mean the point of contact that people have with their healthcare professionals. And when they did get advice, mostly it's because they had looked for it. 50% said that there was no proactive outreach whatsoever. What's interesting, and I think it's also quite consistent with what the FEND survey showed, is that there was a rapid deployment of alternatives to face-to-face consultations during the crisis. Prior to the crisis, 70% of people reported that virtual consultations were not available. But during the crisis, twice as many people reported that they had gained access as did not have any consultation. And we see that again, this was quite amazing in some countries which prior to the pandemic, and that's the red circle, reported not having access at all to virtual consultations. And by the end of the period, in some areas of Spain and Portugal, up to 50% of respondents said they had gained access to some form of virtual consultation. So these proved quite helpful. They did help people better manage their diabetes, but obviously they are not the panacea, and quite a lot of things need to be done to make sure that they achieve their aims. A third of people in the survey said that they would not want any virtual consultations moving forward. And close to half said that they would welcome them, but only as part of a mixed system of care. And again, we have to look into the data in more depth, but there were significant differences in the willingness to engage in virtual consultations depending on the countries, with respondents from France, Belgium, and Luxembourg particularly opposed to the idea. One of the biggest challenges for people living with diabetes during COVID was the lack of guidance. And that's very important because developing a serious form of COVID-19 was the biggest worry expressed by our respondents. And what we see is that 2/3 of respondents felt that they needed more information. 1/4 felt that they had received zero guidance by anybody. And that the clarity of the guidance given was very much lacking. One thing, and again, that reflects to a certain extent the medical knowledge at the time, but what people felt was that there was no differentiation made between people living with type 1 diabetes, living with type 2 with comorbidities, being young, old, and the risk category in which they fell. So that created a lot of anxiety and made it very difficult for them to manage COVID-19. So in conclusion, what we can say is that our survey confirms many of the observations that were made in other studies. There was a significant disruption in access to care, medication, and supplies. In many countries, there were delays reported in people's ability to access insulin, for example, or access the right brand of insulin. And sensors were particularly problematic in many countries as well. That led to a deterioration in the ability of people to manage their diabetes as they want, and it did have a strong impact on mental health. Now, what we saw is that there was a very swift move to the use of virtual alternatives, but that this will need to be adapted to better meet the needs of people living with diabetes and further integrated as part of the healthcare system. So the final conclusion is really that we can see huge disparities and inequalities in the way that, in the challenges that were faced by people living with diabetes across Europe and the way that systems were able to respond. And I think that really reinforces the notion that we need a very strong European of health, a European Union of health that will help us transform national health systems and ensure much closer collaboration and exchange of best practices across Europe. Thank you.
Sabine and Rita, thank you very much for presenting these surveys in much detail. We are way over time, so I would suggest a very quick reply by our two chairs, Anne-Marie Felton and Professor Lalic, to maybe each other survey and then head straight for the closing remarks. I think we'll have to cut the Q&A due to lack of time. Anne, would you quickly like to say something about the survey of IDF Europe, and then maybe Professor Lalic, you can comment on the other one, and then we will close it here.
Well, I think both surveys, if I may say so, really reflect, there's a real resonance between both of them. And I think there's a real opportunity for FEND in conjunction with IDF Europe to work together more closely to help resolve some of these issues. So thank you for that opportunity. Thank you to all of you in IDF, particularly to the leadership, and for us to reiterate that we will continue to support the Youth Leadership Training Programme. It's hugely important. Rita, thank you so much, and Sabine.
I'd like to add that this is what was already slightly tackled by Anne-Marie, and that is these two surveys are somehow complementary, and they are showing that we are going the same direction, and it is now caused by some independent inputs, let's say, but let's do it together in future, I mean, and see what might be the overlaps, because really the improvement of diabetes care during COVID and after that should be a sort of joint action.
Thank you, Anne-Marie Felton. Thank you, Nebosa. So for the concluding remarks, I'm aware that MEP Sirpa Pietikainen already had to leave, but Crystal, you're still on the call. Please wrap this up. I would love to hear your closing remarks and your call to action, maybe from the MEP perspective.
Thank you very much. First of all, thank you all of you for making these very important and very interesting presentations. I definitely learned a lot. I also see that we have some things we still need to discuss. First of all, the consequences of COVID-19 on our health systems in general, and for patients with diabetes in particular. We need to have a focus on whether they are treated the way they should be, if they have sufficient access to both medicines and treatment and things like that. We really need to do something, and maybe we could raise questions to the European Commission, whether they have an overview over the situation, or having an idea about how this works throughout Europe. Secondly, I also think that we have just started the discussion around the professional qualifications or health personnel, health staff in general. Do we have enough qualified persons in Europe, and how can we make sure that things are working in a good way in the future, looking into who has the right to do what? I think we need to discuss this more. Maybe even, I mean, it came also up here during the presentation on the COVID effects, that maybe we should look into use of e-health or digital tools, or maybe even artificial intelligence in the healthcare and for diabetes patients in general. I think that could be interesting. So I think there's so many important topics that we have been just starting to discuss today that we need to focus on in the future. But there's no doubt that our nurses plays an important role in order to have a good treatment for our diabetes patients throughout Europe. So with that, I would like to say that I find it extremely important. We have several things to do. We need to prevent better in these areas where we can prevent. We need to have an early detection for diabetes in order to give patients a better treatment. We need to have quality care, I would say, sorry, for the patients, and of course, ultimately, hopefully also a cure, but that's not on the table at the moment. So there's so many things we need to discuss and work on, and I hope that we at the European level can do more. I also think that we as an MEPs need to do more. We need to have a focus on this. We need to put diabetes higher up on the agenda, and therefore I'm happy that today we are relaunching our working group for diabetes, or members mobilizing for diabetes, as we call it now. We need to make sure that we don't have a beauty contest amongst diseases at the European level, but that we treat diseases on an equal footing, and respect the differences between the diseases, but also realize that we can do a lot of things together for chronic diseases and not just cancer. So with that, I would like to say thank you so much, and I'm so much looking forward to our cooperation. This is a topic that is close to my heart and has been for many years, and I'm really, really looking forward to keep on and maybe even strengthen my involvement in the fight for better diabetes treatment for the many, many patients we have throughout Europe. Thank you so much for today.
Thank you, Crystal. So I will close the seminar now. Thank you so much, Crystal, for being here. Thank you, Chantal, for taking time out to be here. Thank you to all our panelists for the absolutely amazing, amazing, amazing discussion we had, as well as the great survey that you presented. So, and I'd just like to point out IDF Europe represents everybody across Europe, not just the EU. We've had lots of participants from the non-EU countries. We'd love to hear more from you on how we can influence in your countries too. We are an inclusive organization, and we would love to be able to do that as well. Anne-Marie Felton, you remain a hero, always. And for all of us in diabetes care, Rita, thank you so much. Dr. Ravish, thank you so much. We hope to take this discussion forward. It's only the start. And thank you very much, Bastian Hock, for facilitating amazingly, as you always do. Good luck, and carry on celebrating World Diabetes Day. It's not a day. It's a journey a lot of us have been on for many, many years, and we continue to advocate throughout the year. Thank you, Elizabeth and Sabine from the office, for coordinating such a great seminar, and thank you all for attending. Have a lovely day. Bye.
Bye-bye.
Bye. Thank you.
Bye. Thank you all for joining.
Bye. Thank you.
Bye-bye.
Bye.